Subaru.
And it is your Medical Monday interview. Thank you very much for sticking around. I'm here with Dr. Robert Garwood from RMH. Appreciate you stopping by.
My pleasure.
And we're talking about a way, I guess, surgically or medically to lose weight. You know, gastric bypass is something people know about. RMH is offering lap banding now. What can you tell us about that?
Well, laparoscopic adjustable gastric banding is an alternative to the gastric bypass as a weight loss surgery. Unlike gastric bypass, which alters the GI tract of the patient, lap banding, we place a elastic ring around the top of the stomach to create a small pouch, which limits patients' food intake and helps them lose weight.
Okay, so that's way different than from gastric bypass, but still a long process, not a quick fix.
Correct. Both procedures take a commitment of the patient for dietary and lifestyle changes, and neither one is an overnight cure. The difference between the lap band and the bypass is that the bypass actually staples the stomach and reconnects the gastrointestinal tract, thus creating staple lines and potentials for complications.
Okay.
The band is a much simpler procedure. Patients are in and out of the hospital in a day and back to their normal life within a week.
But you say in and out of the hospital in a day, people hopefully won't get the wrong impression there.
No.
So if exercise doesn't work for them, if eating right isn't working for somebody, they should know about this alternative at least. But I guess tell me, who is applicable for this kind of procedure?
Well, patients need to have a certain amount of excess weight. We use a scale called the BMI, which is a mathematical form of height versus weight. And they need to have a number of 40 or above to qualify for any weight loss surgery, laparoscopic band or bypass. If they have comorbidities such as diabetes or hypertension, arthritis, or sleep apnea, that goes down to about 35. And then there's a series of insurance criteria that varies from insurance company to insurance company that we help them meet and at RMH.
Okay, and health benefits, any kind of disadvantages health-wise, I guess, if you don't keep up on it, but tell me about the advantages.
Well, all weight loss surgery, and the laparoscopic band is no exception, provide immediate weight loss benefits in terms of within 3 years, patients can expect to lose 65% of their excess body weight. And folks with diabetes or hypertension can expect 80% resolution of their symptoms and even higher of reducing the number of medications they're required to take. So if you have diabetes and you can take insulin, we can often get you off your insulin requirement. Or if you're on several high blood pressure medications, you usually can get down to one.
Okay. So if one of our viewers now falls into that category, how do they go about getting more information?
They can call us at RMH Bariatric Surgical Services. They can get online at rmhbariacsurgery.com or call RMH Health Source.
Okay, and the number right there is on your screen, 1-800-433-4580. The website that he just mentioned, and remember, Dr. Garwood, thank you very much for joining me. I really appreciate it. And